Now, let's learn how to use this product. First of all, we suggest to you to use by mesotherapy, but for different patients, maybe some of them is not suitable to object the mesotherapy. So let's see some precautions. It is forbidden for those whose skin is in acute state of allergy or those with progressive skin disease, and those who are allergic to PLLA or PEG are not suggested to use. And according to the doctor's advice and according to the course of treatment, the effect can be superimposed and last longer. And avoid pregnancy, lactancy, and menstrual period when used. And immediately after surgery, apply a cold compress to the repair mask and release minor redness and swelling. And to avoid infection, keep your face away from the raw water in 24 hours after surgery. And use a hat or umbrella for 1 week to avoid post-operative tanning. And ban smoking and drinking alcohol, eating seafood, spicy food, and strenuous exercise within a week. Using ZQ-II Repairing Series product is really recommended after the treatment. Okay, let's see the operational specification. First of all, we need to ready about it. Clean the face thoroughly, clean it out, clean the dirt for 3 minutes. And then, if your clinic is your salon, got the skin texture. Check the skin situation by the skin detection. If you don't have the skin detector, take 3 photos at least before you use for the front face and both of the side face. 3 pictures, 3 photos in total. And then apply the facial numbing for 40 minutes and disinfect for 2 minutes. And then use the skin surface anesthetic to quick sterilize twice. The surface that is unified. And in the treatment, inject ZQ-II Nutrients Fills for 15 minutes. If you inject for every 1 piece, inject it in total for 5 ml. And need to be painless and precise treatment during the treatment. And also, if you don't have the meso gun, we also suggest you to use the microneedle roller to inject our product 3 times as a course of treatment, and for every 20 to 30 days as a course of treatment. And the depth we suggest to you to use around the eyes area, that is 0.25 mm to 0.5 mm. Cheek bones about 0.8 mm, and the other part that is 0.8 mm to 1.2 mm. After treatment, need to repair the skin. Use medical ice pack to immediately cool down the skin for sedation for 15 minutes. And then use the repairing soothing mask for 15 minutes. Use it immediately. And before you use it, you can put it in the refrigeration. And then you can also spray the repair factor essence for 3 to 4 times. If you did not get moisture enough, also suggest to use the skin barrier repairing gel. Use it immediately. Apply it on face. In home use, we suggest to you use repair factor essence for 3 to 4 times in a day, and using the repairing soothing mask for at least 5 days. And we also suggest you use for every 7 days, and in every 1 day use for every 1 sheet mask, repairing soothing mask. And then we suggest to you to use the skin barrier repairing gel to keep your skin moisture and fasten the repairing. And we also suggest to you to use the sunblock cream for 3 days later. Apply it to the face. If you got some of the photoelectric treatment or got some other aesthetic treatment, you want to make a treatment together with PLLA. Here are some of the suggestions to you. First of all, PLLA can combine with the medical aesthetic treatment like Botox, Nutrients Fills, and the photoelectric equipment. Let's see. Okay, first of all, PLLA is compound with 10 to 20 units of the toxin is available. And how to use? Use this for once a month, and also 3 times as a course of treatment. The depth is controlled 0.8 mm to 1.0 mm. The operating is under the guidelines of doctor. And the combination of toxin and ZQ-II PLLA anti-dynamic and static wrinkle together to meet multi-needs of customer. And the effect is gradually showing after treatment. And we also suggest to use together with some of the other Nutrients Fills like the mesocloctel. And the ratio that is 1:1, like 5 ml of the mesocloctel together with 5 ml of the ZQ-II PLLA. And the treatment that is once a month as a course of treatment, and once a month to use it, and 3 times as a course of treatment. And we suggest to use both mesogun and microneedle roller together to operate. Like mesogun first, the depth is about 0.8 to 1 millimeter, and then use the 0.5 micro needle roller, 0.5 mm micro needle roller. And also our product can use together with the RF micro needling. Like if you combine it together with RF micro needling, you need to clean the face first, and then operate the RF micro needling for the next step, and then just made our PLLA Nutrients Fills immediately after the RF micro needling. If you combine it together with IPL, first of all, also cleaning the face, and then apply the facial numbing. Operate IPL, and then operate ZQ-II PLLA by mesogun, like 0.6 mm to 0.8 mm, or microneedle roller 0.5 mm or 1.0 mm. Also can use together with RF facial equipment. Operate RF facial equipment first, and then use repairing soothing mask. And then apply the facial numbing, and then operate ZQ-II PLLA by mesogun or microneedle roller. And when combined with RF, need to make sure operation match with the operating instruction of that equipment for different brands, because different brands of the equipment, maybe they got different precaution and something to need to know. And if necessary, operation need to be postponed after some days. And PLLA combined application with picosecond laser, high energy anti-melanin, making it appear in a particular state, which is more easily to metabolized by the skin and reduce dullness and discoloration of the skin. And the observation step, that is cleaning the skin, apply facial numbing, operate picosecond laser, and then operate ZQ-II PLLA by mesogun. And if there is some scalp after picosecond treatment, PLLA treatment need to be wait 2 to 3 weeks after the scalp to fall off. And if it's combined with ultrasound Canon, use the ultrasound cannon first, and then use the repairing soothing mask, and then apply the facial numbing, and in the end operate ZQ-II PLLA by missile gun. The depth also from 0.6 to 0.8 mm, or microneedle roller 0.5 mm or 1.0 mm. And if it is combined with the fractional laser, okay, yeah, it can jointly promote collagen regeneration, and it can also repair tissue damage after the photodermal treatment, and promote the epidermal support and regulate metabolism cells discipline. And after the facial laser, we can apply ZQ-II PLLA Nutrients Fills on face immediately. And if it is need to inject it with mesogun or microneedle roller, the client need to wait 30 days later to do another treatment. So the effect of our PLLA, they got the moisturizing, brightening, firming, and lifting effect. First of all, the skin texture would be improved. After PLLA and PEG enters the skin, it can be decomposed by the body into carbon dioxide and H2O, promote microcirculation, skin becomes hydrated, and then the skin tone is improved. PLLA and PEG degraded release promotes the regeneration of type 1 collagen and repair fine lines. Lactic acid inhibits tyrosinase activity, brighten the skin tone, and then firming the skin becomes more elastic. Type 1 and type 3 collagen regeneration, firming the skin, restore elasticity. And then that lifting, slightly feeling effect, comprehensively face lift and firm, and the elastic skin whiten and growing the skin. The treatment effects that after the first time got whitened and tender, and second time got firming, and after the third time got the brighten and growing effect.